So we will get the meeting more formally underway. And we're just going to start by asking to have the members of our panel introduce themselves very briefly. And for the panelists, we're going to just follow the order from our draft agenda. So on the document that I have, that has me asking Shannon to introduce herself first, and then Casey and Natasha from FNHA, and so on. So I'll pass the floor to Shannon at this point. Thank you.
Good evening, everyone. Kisakukit. I'm Shannon Gerling-Hebert. I'm the Administrator of Quality Assurance and Service Integration for the Ktunaxa Nation, and I'm also Ktunaxa Nation Transformation Manager with the Interior First Nations Health Authority team.
Hi, good afternoon, everyone. My name is Casey Neathway. I'm a regional manager with the First Nations Health Authority and the vaccine lead for our Interior Region team, supporting all the First Nations across the Interior.
Hi there, I'm Natasha Hatendi. I'm a community health practice consultant in the Interior Regional team, and I also support the communities in the Interior region. I also have a couple people here that I invited from the CD team, if Rajbir and Julian, if you just want to introduce yourself as well, because I know you probably weren't on the agenda.
Perfect. Thank you so much. My name is Julene. Thank you so much for having me. I'm a clinical nurse specialist with the CD management team with FNHA. And I also have quite a few years of experience in immunization, so I hope that I can lend a hand with answering any questions. And of course, if we can't answer any questions, we certainly will bring resources forward for everyone and follow up. And I'm joining you today from Coast Salish Territory in Vancouver. Thanks for having me.
Hi everyone, my name is Rajbir Bassi. I'm the nurse coordinator on the CD team, and I work with Julene on the CD team and CDPPH. Thank you.
Hi, my name is Brittany Groff. I'm one of the community health nurses from Ktunaxa Nation.
Hi, I'm Sara Chorney. I'm a new community health nurse with the Ktunaxa Nation.
My name is Dallas Cardinal. I am the community health nurse. I am new here, so thanks for inviting me today and taking a listen.
Hi, I'm Heather, the community health nurse for Yakaduk.
Thank you very much, everybody. As folks will probably have seen as well, that mystery voice that we heard was Jesse from our communications team at the KNC. So Jesse will be monitoring the chat and supporting as best he can with any technical issues that folks may be having as well. So just to acknowledge Jesse on the call as well and thank him for his support. So at this point, I'd like to open the floor to Casey, in particular, I think, who's going to be able to speak a little bit about some of the logistics accompanying the vaccine rollout in BC. And once Casey and Natasha and any others from FNHA conclude their remarks, then I'll be passing the floor to Brittany and Sara, I think, for the first little bit on the nursing side. So thank you, and floor to you, Casey.
Great, thanks so much, Justin. So yeah, I'll start off fairly broadly and go through some of the specific questions that were in the agenda as well, and then certainly we're here to answer any other ones or any specific ones that might come up. So more broadly, you will have seen about a week and a half ago, the province rolled out the immunization phase guide. So there's 4 different phases in terms of the immunization schedule for the province of BC. Right now, we're still within phase 1, and included in phase 1 are rural and remote First Nations. And then in phase 2 is essentially all other First Nations who weren't covered in phase 1, as well as individuals who are 65 years or older. So those would be urban and away from home First Nations individuals, 65 years or older, and elders, with elders being a category defined by community and not defined by the province. And so The expectation provincially, and we haven't heard anything outside of that expectation, is that by the end of March, all First Nations communities across BC will have access to the vaccine, and that rollout will be complete. So right now we are, like I say, still working through those phase 1 rural and remote communities, and you will have heard as well, probably globally, some restrictions in supply of both the Moderna and Pfizer for various reasons. So Pfizer was retooling their plant to start producing more vaccine. Moderna, I think there's maybe some less specific reasons for the shortage in Moderna, but that did impact the speed of our rollout slightly. The number of doses we were expecting to get in February was reduced but by about half. So, and when I say we, I mean the entire province and the country as well. So that wasn't just an Interior First Nations or even just a First Nations Health Authority thing. So we're working through that, but the province has not indicated any changes to that intended plan of a end of March rollout for all First Nations communities. So what that actually looks like on the ground, and so one of the questions that was in the agenda was how much notice the community will get before the vaccine is arriving. I will say our hope is that it's a couple of weeks to give communities time to plan, but the reality is that sometimes we don't actually know the specific date of arrival for the vaccine until almost the day of or day before. And it's kind of like if you're waiting at home for your Amazon package, or when you used to order something from the Sears catalog, you wouldn't know exactly what day it would come in. So it's the same thing. We're literally waiting on FedEx to send their tracking number and then say, oh, okay, well, it's leaving Kamloops. It'll be there this afternoon. But generally speaking, we have a broader concept a week or two ahead of time. And then as we roll into phase 2 and increased availability of vaccine, I'm hoping that it's a little bit more secure in terms of timelines on how much notice. But with that said, our recommendation is certainly that communities can start and should start the vaccine clinic planning ahead of time. So we know, I assure you, the vaccine will be coming. So there's no question there. And so it's just a matter of when. So if you can start thinking within your own communities of, what kind of supplies do you need? What kind of immunizers do you need? What's your human resource capability? Where are you going to have the clinics and all those sorts of pieces? Those are some good things to think about, even if we don't have an exact date yet on when the vaccine is coming to your community. Our plan right now, so the plan we submitted to the province, and again, we being FNHA, and this was a plan approved by the Ministry of Health and Immunize BC, was for a whole of community approach to vaccinations. And what that means is that we have requested and generally have been receiving enough vaccines to immunize all community members who are 18 or older and live within the community, and essential service workers who work within the community. And we know that vaccines are a personal choice and not everyone will choose to become vaccinated, but we don't want the risk of missing out those people who do wish to receive a vaccine. So those are the population numbers that have been submitted to the province. That's based on both Indigenous service data and census data for 18 plus individuals. So in terms of your clinic planning, those are roughly the number of vaccine doses that you can expect to be receiving. And then there's a letter that goes out to First Nations leadership, and so right now we have that going to both clinical leadership and political leadership. So chiefs, and then also health directors and clinical leads, nurses, outlining that the vaccine is coming. So once we have an allocated dose for your community, you'll receive that letter. And then that letter indicates a 7-day initial clinic rollout. So we don't want vaccines to be sitting in fridges or sitting in freezers, not going into arms. We want people to become immunized. So that letter indicates an initial 7-day clinic period. And then at that time, or I guess before that, we'll start having the conversation with your community about how many doses have been used, and if there are some that aren't being used. And then any reallocation of vaccines, which could either be to or from your community after that 7-day period, would be a clinical decision by senior leadership and senior medical staff, both in FNHA and Interior Health. So that would be the Chief Medical Health Officer for Interior Health, Dr. de Villiers, and then the FNHA Chief Medical Officer, Shannon McDonald. So the FNHA team, our regional team, our operational team don't make any decisions on where vaccines are going. That's decisions made at provincial tables and at clinical tables. And so in some circumstances, we have seen the allocation of vaccines outside of that whole of community approach to communities that have significant numbers of positive cases to help them through those times. But again, those are clinical decisions and not operational ones. Going through some of the other questions in the document, is it for all First Nations people or just those living and working in the community? So the vaccine rollout through FNHA is, as I mentioned, for those 18 plus individuals living within the community. And then we're also working with Interior Health on those phase 2 programs. So those are the elders and the First Nations individuals 65 plus. And those would be clinics that would be in collaboration or operated by Interior Health in partnership with FNHA. And then alongside that, we're also advocating for the inclusion of all away from home members in those earlier phases. So certainly we can guarantee that everyone who wants to receive the vaccine will receive it at some point. And you can look at the provincial document and see where each of those age cohorts is in the 4 phases, but our advocacy is to include all urban and away from home members in those earlier stages. And of course, we don't know how much vaccine will be available, but certainly it's our priority to raise that as much as we can to the appropriate tables. And I think that leads into the next question as well, is when urban First Nations people will get their vaccine. And so, if you look at the phase document, depending on age cohorts, that would be kind of through the summer and into September. But again, our advocacy is to include urban and away from home populations in those earlier phases. And so we're literally as we speak, in the coming hours, days, working with Interior Health to keep pushing that advocacy and see if we can raise that for more than just the 65 plus and the elders. I'll throw over to Natasha for some of the clinical questions. And I think just the last thing to note before I do is that in terms of the clinic rollout and the operations and all the logistics, we are 100% here as a partner to communities to help you out, to support, to walk alongside you on this journey. So when the vaccine comes, we will also provide all your ancillary supplies, the cotton swabs, and Band-Aids, and syringes, and needles, and everything you need. We'll work with your community and with Interior Health for an appropriate storage location for the vaccine. We will handle all the transport. The logistics of these products are annoyingly complicated, I'll say. They are super sensitive, both in terms of temperature and shaking. So we'll take that off your hands, and we'll make sure that whatever you guys need to roll out clinics in a good way and to have access to the vaccine for your community members, that we'll support with that. And then in terms of communications, going back to when the doses will be received, certainly as we hear any indication from the province of increased available doses, then we'll start communicating with both the clinical staff and the leadership staff. So we know that it takes a fair bit of work to start rolling out clinics and to get everyone where they need to be. So we'll give you as much notice as we possibly can. And if you wanted to start that planning, before we have those identified doses, we're also here to support that pre-work as well. So I'll throw it over to Natasha now for some of the more clinical questions that came up.
Awesome. Thank you, Casey. So I'm just going to talk a little bit about the vaccine and answer a couple questions that was on the agenda that was sent to me. So I wanted to first start off by talking about what the COVID-19 vaccine is for those from the community on the line here. So the vaccine, it helps to develop immunity to COVID-19 and prevents you from becoming sick if you were to come in contact with the disease. And the recommendation is that everybody over 18 in Indigenous communities get this vaccine. And what will happen once everybody gets the vaccine is that there will be a community of immunity. So it'll create a protection within the community on reserve so that COVID can't get in. And the younger population will hopefully be protected by those older population because the vaccine is not licensed yet to use for that under 18 population. So the vaccine works. It's got a messenger RNA in it, so it's different than the flu vaccine. It's a new technology that's in the vaccine. And what this mRNA does, it goes into the body and it helps to create a protein. And then your body replicates that protein and then recognizes, is able to build immunity based on that and to protect you against the COVID virus when you come in contact with it. So there are currently 2 vaccines that are licensed in Canada to use. The Pfizer vaccine and the Moderna vaccine are both available, and both of them have been going out to communities. So you could either get Pfizer or you could get Moderna. And both of these vaccines, they have gone through rigorous studies, and the reason why it's been so fast in approving them is a lot of that bureaucracy has kind of been skipped over, and sometimes that is what delays a lot of technology and vaccines from getting forward. So they haven't skipped any of the safety precautions with these vaccines. They're totally safe, and they work well. So with the vaccine, both of the Pfizer and the Moderna, you do need 2 doses to get immunity from this. So with the vaccine, it's about 6 weeks you get from the first dose. So that is why you need to get the second dose. So the first dose kind of acts as like a little bit of a primer. Your body recognizes it, starts to build some immunity, but then it needs an introduction of that second dose to build a little bit longer term immunity to the COVID virus. It's unsure right now how long the 2 doses are going to provide, but the studies are looking good that they're providing good coverage. With the first dose also, you're only going to get about 70% coverage, and then once you get the second dose, it boosts your immunity to 95% coverage from the disease. So this is a really good efficacy, like it's really strong protection for when you get it. The second dose is licensed to get it's recommended to get, between 28 and 42 days apart. So in First Nations communities, it might be more a little bit towards the 42-day mark just because of the availability of the vaccine right now, but it is totally effective at that mark as well. And if for some reason you weren't able to get it at the 42-day mark, you can still get it after that, and you don't have to repeat the first dose or anything like that. So for the vaccine, Moderna or Pfizer, you do have to get the same product for the first and second dose. So if you get Moderna the first dose, you have to get Moderna the second dose. It's not, it hasn't been studied to cross doses yet, those kind of things. And then the population that currently the contraindications, or what that means is the people that shouldn't get vaccinated. There's only one contraindication, and that is if you've had an anaphylactic reaction. So that's a severe allergic reaction to the vaccine or any components of the vaccine. And the one component that's in the vaccine that has been shown to be causing a few more allergic reactions is the ingredient called polyethylene glycol. This is used in laxatives and in a lot of products we use, but it has been causing a little bit more allergic reactions in individuals. So if you do have a known allergy to that ingredient, we would advise you not to get that vaccine, or if you had an allergic reaction to the first dose. There's been lots of discussion about vaccinating like pregnant women, breastfeeding women, or immunocompromised. All of these populations are eligible for the vaccine, so you can get the vaccine. It's just if you can, since we're waiting for it, it would be a good idea to talk to your doctor right now to see if your doctor wants to stop any medications or they have any suggestions around your specific conditions. But there's no, it's not contraindicated. So that means it's not, you can still get it. It really depends on the nurse, and you can have a discussion with your nurse if you haven't talked to your doctor. With immunocompromised conditions, the discussion might look like the vaccine you might not get as strong immunity from the vaccine, but you will get some coverage from it. We're unsure about how much coverage you might get from it. For example, if you're on like arthritis medications, it might reduce your protection. So you might still be at risk for getting COVID or at higher risk. And then with pregnancy and breastfeeding, it's not contraindicated. It can be given during that time. There was a few people that were unknown who were pregnant during the studies, and they haven't had any adverse events or bad outcomes in those. And since there has been several people vaccinated who have been pregnant and breastfeeding, and we haven't heard of any adverse events related to the fetus or anything. I think I'll probably end it there, and I can answer lots of questions. I don't know if Julene or Rajbir has anything to add for that part, but they can definitely help answer some of the questions when they come up.
Thanks, Natasha. I think we'll certainly keep everybody sort of on standby again as questions start to come in, or as they occur to folks. Please, feel free to drop them into the chat, because we will have a record of them and can address them in due course. But at present, I think I'd like to turn it over to our community and KNC nurses. So I think it's Brittany that I'll ask to speak at this point. Thank you.
Hi, thank you, Natasha. You did such a great job explaining everything. That was wonderful. One thing that I'm going to touch on real quick is just some common side effects. This has been a question that's been coming up. So common reactions to the vaccine may include that soreness, redness, swelling where it was given in your arm. And some other reactions may include tiredness, headache, fever, chills, muscle or joint soreness, or some mild nausea and vomiting. And these are all common reactions with all vaccines, so not different for COVID. And then Natasha touched on anaphylactic reaction. So there is that very rare chance that you could have a reaction, but all of the nurses at the clinic are trained to treat anaphylaxis. We'll have our kits with us, and we've all gone through some recent training. So everybody's up to date, which is really lovely. And then we're going to kind of move into where we are with vaccine rollout in each of the communities. We wanted to share with you where we are at with supplies. So all of our required supplies to immunize has been ordered. It's stored at KNC right now, and the community nurses have been ordering some of their own supplies as well. We've recently trained a few nurses. So we have 8 nurses with KNC who are trained to provide vaccines, and then we'll be teaming up with all of the community nurses to go out to their community and administer vaccine when the time comes. I'm going to let Heather and Dallas maybe speak to what rollout looks like in their community, or if they have anything to add.
So Heather, I'll go first, if that's okay. Hello, my name is Dallas. For those of you who haven't met me before, I am the community health nurse. So what we have been doing lately is doing all of the training, all of the information. We have been inundated with all the lovely FNHA information that's coming out about the vaccine, in communication with KNC nursing, connecting with community. Generally, we're finding that they like to do more of a face-to-face kind of communication. So catching them at the local store and saying, hey, what do you feel about vaccine, or have you thought about it? I've done a Zoom meeting already, a Q&A for the band meeting. I don't know if any of you were able to catch that. So just really trying to generate conversation between people and get them thinking about how they feel about vaccination. I know generally there's mistrust in healthcare, so we're really trying to get them to delve deep inside and like, what do they want or what do they believe in, and try to take some thoughts and giving them some time to digest, and then going back and saying, what did you come up with, and then sharing some information if they have any questions, you know, what are their concerns. So right now, generating a list, we're going to be doing cold calls, basically. I'll let out to all the community, or again, I thought about just setting up at the store because we probably see a lot of band members just coming through the store on a daily basis. So reaching out, getting a yay or a nay, basically putting them on a list. Like we've already heard that it could be potential quick turnaround for when we do find out that we're getting vaccine. And then having some door-to-door kind of knockers, like a poster that's dropped off, and you would call our health clinic, you would say, I'm interested, put me on the list, where we would create like a schedule for you to come in, what to bring, not to bring, what to expect, what not to expect. And then we're just gonna pump people through, and hopefully it's a positive experience where hopefully someone from Chief and Council is gonna start us off with like a really positive kind of messaging for the day. It's been long coming, and it's been a long journey, and I'm tired, and I'm sure you're all tired. So it's nice to hopefully see the light at the end of the tunnel of all of this. That's what we've been doing.
Thanks, Dallas. We are doing probably a similar approach here at Tobacco Plains. We are trying to get information out to community, both just sending vaccine information in memos and posting virtually and hosting Zoom meetings and sharing information with staff so we can try to get accurate information out in community. In terms of being prepared for the rollout in our community, myself and our medical office assistant, Kayleen, are working with community, and Kayleen has started to reach out to people mostly by phone, and our pre-screening process have already started ahead of time so that anybody that may have additional questions or health concerns or need a health consult can be vetted through me ahead of our clinic day, try and minimize last minute questions arriving on clinic day. So we've had a great response from staff here, and most departments have had staff volunteer to help on clinic day. So I think we will be well positioned once we get our vaccine.
That's awesome. Thank you both for sharing. I think at this time, we will take some questions. So if anybody has any questions, write them in the chat box and we can do our best to answer them. And if anybody from FNHA has anything they'd like to add, this would be a great time.
Of course, the downside to the chat box is that we have these long, awkward silences while we wait if anything comes forward. And I think I would just like to, while we maybe wait for some questions or some comments to come into the chat, would just really like to emphasize a point that Dallas made there, and I think she made it really well. So much of this is just about having a conversation. And wherever those conversations need to take place, whether that's for you individually or for family members, friends, just the willingness that there is to support that conversation and provide information or resources wherever folks are at. And so, you know, Dallas certainly spoke well to that, and you know, whether it's with nursing staff and community or at the KNC, or access to, again, the resources available from FNHA and IHA and others. There is an abundance of information out there, and it can sometimes be, I think, overwhelming when we see it in the news every day, and the various emails, and then sessions like this where so much information is provided so quickly. So as I said at the outset, this isn't this isn't the end, certainly, of the opportunity to connect and have further conversations, or again, share whatever supports are necessary. So
Justin, I might put a few comments
Heather.
out that maybe Natasha can respond to. So just in terms of vaccine hesitancy in our community, some of the common themes. So I'm hoping that people on this meeting, once we have kind of the current and accurate information, can bring that forward to share with community. But two of the common themes are, one, fear of the vaccine because it's new. And two, fear of life-threatening reactions based on media reports that there's quite a bit of more anaphylaxis happening with this. So that would maybe be a helpful thing to be addressed here.
Absolutely. Thank you for those questions. As far as the life-threatening reactions, the main reaction that we're looking at that's life-threatening is anaphylaxis again. So that is, again, a severe allergic reaction. And with the Moderna vaccine, we are seeing a little bit higher allergic reactions, but again, it is still 2.3 per 1 million. So it's not really that high, so still very uncommon. With the Pfizer vaccine, the reactions are 11 per 1 million, so definitely a little bit higher, but again, still not what I would say is common. So I don't know, does that answer that, Heather? Okay, perfect. And then the other part of your question was, can you just repeat it? I've got a kid here, like, dying for my attention.
People having vaccine hesitancy, believing the vaccine is new.
So yeah, I've been hearing that a lot as well. And the vaccine, again, is very new, but it has gone through all of the rigorous safety protocols and passed all through the clinical trial steps that all other vaccines have gone through. Again, it is going to work so quickly because the whole world is literally focused on this vaccine right now. And that bureaucracy was just completely fast-tracked, which is one of the big things of reasons why things take so slow usually. But the vaccine is safe, and we're not seeing people dropping dead or anything like that from getting the vaccine. So yeah, I do see a question here about a fish allergy, expressing concern that the vaccine have fish components. I'm not aware, there's no fish components in the vaccine. That's not true. I don't, Julene or Rajbir, can you confirm that or deny that as well?
Yeah, thanks, Natasha. I saw that question coming in, and I was just looking at the vaccine pages in our immunization manual just to double check, and I did not see anything about fish included in the ingredient list. So no fish.
Thank you. Heather, did I answer the second part of your question as well there sufficely?
Yeah, and I think it's important for people to know that the mRNA technology has actually been undergoing research for other vaccines for the past probably 10 years. So it was not invented a year ago. It's been finalized, but it was also under research in cancer vaccines, Zika vaccine.
And if people are like really interested in like the components and all those nitty gritties of the vaccine, Moderna on their website has some really good resources. The product monograph is on there. You can also look at their clinical trials and all the different stages that the vaccine did go through.
Just a question here coming in from Gloria, and I can see people leaning into the screen to read it. I'm wondering, maybe Natasha, again, I put you on the spot. I see you have your assistant there ready to help answer the question, but would you mind speaking, I guess, a little bit to the ongoing public health safety, precautions around masking, et cetera, during the vaccinations?
Absolutely. So yeah, once you do have the second dose, you still do have to follow public health orders and wear masks continuously and wash your hands. We're hoping that once we have, by September, they're saying, or I don't know if it's going to be extended because the vaccine's taking longer and it's been delayed. But once the whole population and we have a really good immunity group of people immunized on and off reserve, then we're going to probably start seeing the reduction in these masks and stuff. And again, that's going to also depend on these variants and how the vaccine is going to work with that. So it's kind of still up in the air, but definitely still follow public health orders, and you will have to still wear masks and wash your hands and everything where after you get your vaccine. So this is just one step into the right direction of that light at the end of the tunnel.
Thanks very much. Just while we see a few questions pop up here, Natasha, you had given us a number of I guess negative or anaphylactic responses per million for Moderna. Can you mention that number again for Alan's just put that into the chat? And then there is a question here: will there be a live attenuated version of the vaccine? And I'm not sure who's best equipped to answer that, but just acknowledge those two questions.
Sure. So the number that I mentioned with the Moderna vaccine was 2.3 per 1 million is the Moderna vaccine, and then it was 11 per 1 million for the Pfizer vaccine. And then as far as the live attenuated vaccines, all the vaccines I've read about, I don't know, Casey could probably speak better, but I think most of them are the 2 mRNA ones that are approved right now. And then I think there's a few AstraZeneca and a few other ones that are more like conventional flu vaccines, and they're not live attenuated. They would just have a piece of protein in them directly, and it would elicit that immune response. Is that right, Casey?
Yeah, exactly. So I don't think there's any live attenuated vaccines in any kind of approval chain or even being considered right now. And yeah, it's a little bit tougher to do live attenuated with viruses because, of course, they need your cells to procreate. So yeah, just they have small pieces of the virus that then trigger your natural immune response. And so we expect additional information on the AstraZeneca and Johnson & Johnson vaccines, I'll say imminently. And the nice thing about those, and I'm going on a bit of a tangent, but it's a useful one, I promise. The nice thing about those vaccines is that the logistics and the storage are a lot easier, and only 1 dose instead of 2. So yeah, once we get those, assuming we get those other vaccines also approved through Health Canada, then that actually opens up a whole lot of other options for us.
Dallas, thanks for very politely raising your hand digitally. The floor is yours.
I probably already know the answer to this, but I thought might be a good prompting question. I'm just wondering, in community, what should we be aiming for the amount of people to be vaccinated? Like, is there a goal that we should be setting? Obviously 100%, but like, what is the goal for FNHA? Have they been achieved? And like, how is that rolling out in other communities?
I think maybe Julianne or Rajbir, what is the percentage for the herd immunity for this vaccine? Do you know offhand?
Yeah, so it seems to me when they get those percentages, there's actually a lot of things that go into it. So early on, I was hearing around 70%, but now, of course, we have a lot of, or not in BC yet, but in other parts of the world, we've heard more so about variants that are happening. So I think that calculation needs to happen a bit again. It kind of relates to, I'm not sure if you've heard of, it's been in the media a little bit, but what they refer to as the reproductive number, or the number of people that someone who is positive with COVID spreads the virus to. So it actually really depends on the calculation around the reproductive number and then how many people we need immunized. So of course, Dallas, as you said, as many as possible, really creating that community immunity and helping to protect all families, all community members, all elders. But yeah, it's at the higher end for sure, 70% and up.
Thanks very much for the answer and for the leading question. Obviously some good dialogue there. An additional question coming into the chat here. Does this mean that we'll have to get this annually like the flu vaccine? And again, I defer, I guess, to Natasha. She's unmuted quickly, so thank you.
Yeah, so I think I'm not 100% sure of this, but I am assuming this virus is going to be mutating over the next few years, and we're probably going to be dealing with this for a while. I don't think that's been hidden from any of us that it seems like it will be something that will be part of a flu vaccine or just a continuous vaccine for however many years. Any other thoughts on that, Julianne? Julianne?
Yeah, no worries. I think, you know, it's a tricky question and a really good question, and something that a lot of brilliant minds are focused on right now. So we know that, again, the vaccine is still new. This whole thing, I think I keep reflecting back to Dallas's comment about the journey, and we're still on that journey to better understand how long this immunity will last for the vaccine. So we know that mRNA vaccines give really, really great protection, but we just need to better understand how long that protection will last. So there are still the clinical trials that are happening. Those are still ongoing in the sense of monitoring the immunity. So we're going to continue to learn more, and that's going to be an evolving answer as we learn more.
Thank you both for that. Casey, I think the next question might be best directed at you. Although outside of your jurisdiction, a question here wondering about the neighboring provinces getting vaccines and whether or not they are in line with distribution as well. So any light you can shine on that, Casey?
Yeah, great question. And the quick answer is I don't know. I know nationally the priority groups are the same across the country. So the frontline workers and those who are most at risk of a COVID-19 infection, and then working through the general population. Timelines more or less the same across the country because, of course, Canada is doing national ordering of the vaccines. But in terms of how other provinces, so say Alberta, are doing their phasing and how that corresponds to BC's, I am totally in the dark. So yeah, no insights on that one.
I'll just acknowledge that question a little bit further, Pete, and I know that we have had some interaction with Alberta. You know, obviously, given our proximity to Alberta and the number of travelers and you know, people who make their home on both sides of the mountains, that is an area of concern. So that's something that we can pull that question and try and run that through some other channels and just get some information, I think, in terms of what the distribution looks like in Alberta, specifically, I guess. So thank you for that question. That's a great one. Again, just a bit of a leading question. I think internally, one of the things that I know has certainly been mentioned, and I'll ask Dallas or Heather if you can just maybe provide some guidance on this. For individuals that may need support around transportation or travel, things of that nature, would you be able to just speak to what's being planned at present, if you can?
So currently we do already provide transportation to community members. We have 2 health vans. We have requested support from admin staff to help transport people to and from homes. We've done that already. Lots of people actually drive here, and families are always supportive, I find, in our communities, willing to pick up their brothers or their sisters or whatever to carry them and bring them over. Sometimes it seems like a family effort where families come together. We have also been offered supports by KNC to provide drivers that way. So driving and getting to the location, I find is not as big of a deal. But again, just call, and then when you call and make your appointment, we'll have a conversation about whether or not you have adequate transportation. And then we just make arrangements from there. Either way, we'll get everybody here.
I would say this is a similar situation for us. We do currently provide medical travel for staff or from staff for community members, and so we will plan to do that for those who need it on the day.
Thanks very much, and I know we don't have sort of health staff represented from Kiskanak or Yakanuki at present, but I know that we've had similar conversations as Heather and Dallas have alluded to, just around supporting transportation. So if that is a concern for yourself or anyone in your family, we do have supports in place to help that along. So so Alan has asked a question. So in relation to the 70% community immunity, asking the question of what realistically it looks like to get there in terms of that level of immunization. And so I maybe will again ask or put this to Heather and Dallas. I think we've had some discussions about what a clinic day looks like in terms of the number of folks that we can accommodate. So are you able to maybe speak to that? And that'll, I think, at least in part answer Alan's question.
So again, we're just gathering our list of people who are interested in getting the vaccination. So that will guide us to know how many actually immunization nurses will need and how many arms and how to program a day or schedule a day, how many hours we actually have to do, factoring breaks and lunches, and is it going to go from dusk till dawn or opposite? Dawn till dusk. How long do we need, or is it going to be 2 days? Again, the pre-work that we're doing, cold calling and connecting with people at the store, knocking on doors will guide us. But 70%. I'm wondering if that is 70% of the eligible people or 70% of the population as a total.
Yeah, I think if we're looking at, I think that question is probably geared around herd immunity. So I think 70% is probably on the low end of what we're going to need for that, but we'll see. But really, we're trying to impress as we communicate with people that due to current vaccine availability, as Natasha said, we may only have vaccine on site for a few days to a week at most. And so really, we want to have that decision making done ahead of time by members as much as possible. So, if people are hesitant and they want to see the rest of the community get done and then make sure they're safe and change their mind in 10 days, they may have lost that opportunity and have to wait until either the regional health authorities have options or we get more vaccine back here. So I think that's an important piece for community to be aware of.
Yeah, and Heather, maybe I'll just add to that. I think that's a really great point. And all the nurses have framed it so well. This is really the great opportunity to have these conversations with your community health nurse and help support your neighbors and family members in having those conversations now as well, to make the clinic days, as Dallas was outlining, as effective as possible, and really helping to support everyone have access to the vaccine and get the vaccine. And still, that's such a great question, Alan, but it's still on that journey and understanding, how the virus is still circulating, or hopefully it won't be circulating as much, but there's a lot of pieces that go into that. But really, really great question.
I'll just the very small piece that I have to contribute to that, Alan, is as was mentioned at the offset, our focus has been trying to ensure that we've got a good number of available nurses to support the clinic logistics themselves, with the expectation that that if we had full uptake from the community, that we would have sufficient staff available to see everyone who wishes to receive the vaccine be able to do so within that same day. So from that side of things, we do have some support in place. And I see now there's been a clarifying question. Thanks, Alan. So the question about when will it be safe to visit from away? And I think that's a very difficult, probably, question to answer. So I'm not sure if anyone would like to speak to that. I guess I would maybe just highlight the comments that were made earlier about the target of September for sort of a Canada-wide vaccination rollout for for the general population. But in terms of that that specific question, does anyone want to offer any insights on that?
I'll take a stab at it. I think that our visiting restrictions will be relaxed provincially or nationally, really, the same way they were tightened, which is based on the levels of COVID in our communities. And so right now, the way we're keeping those down is by social distancing. And when they got too high, we had to restrict that even more to no visiting outside your household. And so I think, you know, once we have vaccination as a tool, that will help us keep the rates lower. And hopefully they will again get low enough that we can start to resume some type of visiting. And I think it will slowly reopen the same way it slowly closed. I don't know if that addresses the question adequately, but as Justin said, First Nation Health is looking at faster immunization for their communities perhaps than the general population, but as a whole, it may be September until we're fully vaccinated and see the rates staying down.
Thanks, Heather. Just acknowledging a question from Vicky here. What is the KNC doing for transportation for off-reserve members? And so it's a little bit of a two-part answer, Vicky, and again, anyone else feel free to jump in at any point. But the initial rollout really that we're contemplating at this point is focused on this all of community approach, which is people residing on community 18 and over. And so as has been mentioned, I think Casey, you were calling it the phase 2, would be individuals off reserve, elders 65 plus would be sort of that priority group, and that those immunizations or vaccinations, I should say, would be handled in concert with IHA. So from a timing standpoint, Vicky, it's a little bit it's like a little bit of an unknown from a sequencing standpoint. In terms of the logistics of transportation, kind of as Dallas alluded to, I mean, we have, at least from the KNC standpoint, we have vehicles, we have the ability and have individuals that are willing to step forward and to support that transportation. So the transportation piece is kind of I think the easier piece to answer in that. The broader question is, what are we looking at from a timeline for that population over 18, under 65, and off reserve? So I don't know, Casey, did I capture that correctly?
Yeah, absolutely. So right now, per the provincial plan, we're looking probably into September, and again, depending on available doses and what other vaccines get approved. Before then, we hope to continue our advocacy to Interior Health to include away from home members in earlier phases. But of course, we have no guarantees on that one. And then I think the only other thing I'll add in terms of transportation is for those individuals who do live within the community. So for those phase 1 and 2 individuals, FNHA can absolutely support financially with transportation to get those folks to clinics. So I know the question was specifically for away from home members, but yeah, if you do have folks who need transportation to get to those vaccine clinics when the time comes, just let me know and we can approve appropriate funding to support that.
I would just add to that too, again, I think we can get fairly creative, Vicky, in terms of what that support looks like, whether it's, KNC staff and vehicle transportation or supporting a family member or others with support for fuel or what have you. There's a pretty broad suite of things that we can absolutely look at. So I'm just taking note of the time, and as I say, I don't want to cut things off prematurely. I am, however, just conscious of the request that we'd made to our folks from FNHA to come on and support the call and acknowledge that we are sort of at our concluding point. So at this point, I think I would just like to, again, thank everybody for coming on the call and for participating and for bringing forward your questions. There's more conversations to be had, certainly. This isn't the only opportunity to bring forward questions that you may have or that friends or family may have subsequently. We will make this meeting available, the recording of this meeting available, and distribute that as a resource. But if you have questions in the coming days or in the next couple hours, please do feel free to reach out to ourselves. Jesse, I'm wondering if maybe you can drop some contact information for some of the KNC staff and presenters into the chat here, so that everyone has a chance to review that. And that information is obviously available on our website, as well as through the band offices and community health centers as well. Vicki, I'd certainly like to pick up this conversation with you directly. I think there's definitely a conversation to be had there in broader parameters. So again, don't want to dismiss it by any stretch, but just want to acknowledge the time, or everyone's time this evening. So I think with that being said, I will wrap this up. Thanks everyone for your time. I know typically we would say safe travels after we conclude meetings, but increasingly that is redundant. So hopefully, if you are traveling, you're able to do so safely, and you're able to stay safe with the cold weather that we have in our part of the world right now. So thanks again, everyone. Takas on Winnipeg.